Hello, and welcome to the first section in your emergency medications chapter, which is chapter 11. We're getting ready to start on activated charcoal. As always, this is Keith Widmeyer with Wayne County EMS. Alright. Let's see here. If the patient is alert and cooperative, medical direction may instruct you to give the patient activated charcoal. Activated charcoal binds or absorbs with many, but not all, chemicals. This ends up slowing down and blocking the absorption process of the chemical in the GI tract. Activated charcoal is produced by heating wood pulp to high temperatures and then activating it with steam or strong acids. This process creates tiny pores on each particle of the charcoal that increases its surface. With this large surface area, activated charcoal will bind with many ingestion toxins. However, charcoal can only bind a drug that is not yet absorbed from the GI tract, and that is key. And what do we mean by that? Not yet absorbed. I guess what we're trying to say is, you really need to evaluate how long this patient imbibed whatever that substance is. And regarding the medical direction, usually, particularly in Kentucky, activated charcoal tends to be on standing orders. Activated charcoal binds many toxic substances in the GI tract to prevent them from being absorbed, and then carries them out of the GI tract. Activated charcoal does not bind well to some substances such as pesticides, cyanide, strong caustics, either really strong acids or really strong alkalis. That's what they mean by strong caustic substances. Iron, mercury, ethanol, methanol, and petroleum products such as gasoline, turpentine, and kerosene. And occasionally you might have a physician get particularly upset with you if you give it to a Tylenol overdose. If they do, just inform them that in your protocol. The reason they end up getting upset with you about that is because that activated charcoal, while it does bind to the Tylenol, it also binds to the definitive treatment of Tylenol overdoses, which is Mucomest. So they end up having to alter their medication dosage, and, well, it makes them have to do some math. If ordered by medical direction and approved by, of course, local EMS and state EMS, you may give activated charcoal for some ingestion poisons. In Kentucky's state protocols, it is in the protocol for ingested overdose of unknown etiology or of known etiology that is not a severe caustic substance, which, again, is severely acidotic or severely alkalotic. Contraindications of activated charcoal include the following: the patient has to have an altered mental, the patient has an altered mental status. The patient is unable to swallow. Medical direction does not authorize it, and the patient has ingested acids or alkalis. Examples of acids include rust removers, phenol, or battery acid. Examples of alkalis include ammonia, household bleach, and drain cleaner. Well, why are these important? You need to take those into consideration. Altered mental status. Well, if somebody has altered mental status, they may not have the ability to swallow appropriately. And if somebody doesn't have the ability to swallow appropriately, then they may aspirate some of the activated charcoal and it may go into their lungs. Some of the adverse effects of activated charcoal include abdominal cramping, constipation, black stools. Some patients, particularly those who have ingested poisons that cause nausea, may vomit. If patients vomit, consider repeating the dose once. Check with medical control on that. The dosage of activated charcoal for adults and children is 1 gram of activated charcoal per kilogram of body weight. Usual adult dose is 25 to 50 grams. The usual dose for an infant is 12.5 to 25 grams. If the activated charcoal is not premixed, mix the appropriate dosage in a glass of water, 8 ounces, to produce a thick slurry. And this is all relative. How do we get kilograms, you might ask? The way we get kilograms is by taking a person's weight and dividing it by their weight in pounds and dividing it by 2.2. I'm going to write up an equation up here. Let's see. So if we have somebody who weighs 220 pounds, then we multiply that by, divide that by 2.2, we'll come up with a result of 100 kilograms. Before giving activated charcoal, you must determine if your patient can follow directions and safely swallow. Activated charcoal looks like tar, stains any material with which it comes in contact, and doesn't taste good. Be prepared for the patient to spit it out, the medication. You may note they do have some that have a cherry flavoring to them. It doesn't make it taste much better, but it does exist. You'll see some places actually carry that. As far as giving activated charcoal, step 1, put on appropriate PPE. Be prepared for vomit. Because charcoal will stain any clothing it contacts, take additional precautions as necessary. Obtain orders for medical direction, either online or offline. Make sure that the patient is awake, cooperative, has an open airway, and has the ability to swallow. Alright. Step 2. Make sure the activated charcoal has not expired. Grasp the container in your hand and shake it thoroughly. This will help ensure that it becomes more of an emulsion. It ensures that the contents are spread evenly throughout the slurry. Alright, step 3. Cover the patient's lap or chest with old towels and have a large basin available should the patient vomit. Because charcoal looks like black mud, the patient may need to be persuaded to drink it. Place a straw in the container or pour the activated charcoal into a covered opaque container and ask the patient to drink it. If the patient does not drink all of the medication in the first drink, shake the container before the second dose because the activated charcoal will settle to the bottom of the container or glass. Some patients, particularly those who have ingested poisons that cause nausea, may vomit. Vomiting may occur when charcoal is ingested either too slowly or too rapidly. If the patient vomits, consider repeating the dose. Of course, you'll need to check with medical direction on your local protocols prior to doing that. And step 4, document the patient's name, drug name and dose given, time of administration, and the patient's response to the drug. If an online order was received by the medical direction, document the name of the physician giving the order. The patient will need to be transported for additional care. Perform ongoing assessments every 5 minutes until you arrive at your receiving facility. All right.